In the past, it's been a common thought if you lived on the east end of Long Island that to get good medical care you had to travel west. That concept is changing.
One of the hardest things to do when I first got here was tell a patient, now we have to send you somewhere else. Now they're finding comfort in that we're keeping them here.
Our trauma program is growing in leaps and bounds. Once you are a trauma center, you need to be prepared for all trauma, and we are ready to take care of all of them.
We are seeing more and more ambulances pull into our emergency department, confidently handing over the patients to our team. We added a layer of expertise when we started training for trauma.
The idea is we can take care of things that don't require heart surgery and basically brain surgery. But everything short of that, we have the equipment and the talent here to take care of right in the hospital.
I was on a bike ride. All of a sudden I was trying to control my bike and I was on the ground. Called 911. They came probably within less than 10 minutes.
We had 3 trauma calls from our emergency department within 15 minutes of each other. We had a stabbing, we had a fall, and we had a motor vehicle accident. Independent of each other, the patients arrived within 15 minutes.
We have a 2-bedded resuscitation room, so you have to be creative when you have 3. So we had another patient outside of the room, and the staff was able to reallocate their resources, divide themselves up, and conquer 3 pretty sick trauma patients simultaneously.
The most acute was a stab wound to the heart. And years ago, that person would have went 40 minutes away and probably died in the ambulance. We got him to the OR and saved his life.
It's like a ballet, an orchestrated, organized system of care. The EMS agencies in our region are truly our partners.
Knowing what is coming our way from the EMS providers out in the field helps us to prepare and be ready.
Having the team ready when we get here is probably the best thing for the patient. So having the CAT scan ready, the trauma surgeon.
We know as a level 3 trauma center that regardless of the problem that a patient comes in with, we will care for them here at Peconic Bay Medical Center, or we will move them to a level 1 trauma center. We can move them by ground, and every bit as important, we have Sky Health, which is our ability to move patients by helicopter.
They are equipped and staffed to handle the most severely injured patients, and it decreases the amount of time they are out of hospital because they consider Sky Health a hospital in the sky.
We've brought an amazing amount of services to the community that weren't here before. We've expanded, plan to expand again in the near future.
We are expanding to a 16-bed critical care unit, state-of-the-art.
It was a cultural change from being a community hospital when I came here to being sort of more of a regional center.
People in our community want to know that there's a hospital there that they can go to and be taken care of.
They did such a fantastic job. There's no need to go anywhere else but here.